Okay, so this is chapter 9, which is about articulations. Whoops, hold on a minute. I'm trying to what I see on my computer screen. So this is about articulations. So joints that's just another word for articulation. So articulations are places where bones come together. So bones come together, bones and cartilage come together, or bones and teeth come together. So it's just where two things come together. So when someone studies joints, it's called arthrology. And the way that they organize joints or articulation is by structure and function. So everything we've been talking about, right, is structure and function. So it's based on their anatomy and also how they work. Okay, so if you look at structural classifications, there are three kinds. So one is fibrous joint. So the bone's held together by dense connective tissue. Okay, so it's collagen holding them together. There are cartilaginous joints, so there's no joint cavity with these. It's just bone hooked together with cartilage. So an example of this would be your ribs. Okay, an example of a fibrous joint is skull and your teeth. And then a synovial joint is what you typically think of when you think of a joint. So the bones are joined by ligaments, and there's a joint cavity that has liquid in it that is between the bones, so the bones don't bump against each other. So this would be like in your knee, is an example. So structure, so it's like what is holding them together. Okay, then functional is basically how they move and if they move or not. Okay, so and these are the key features underneath of them. So synarthrosis, don't move. Okay, so they're immovable, so little to no movement. Amphiarthrosis could be slightly movable, and then diarthrosis can be freely movable. Okay, so if you look at synarthrosis, they could, and you put structural classification in relation to that, they could be fibrous or cartilage. Okay, amphi could be fibrous or cartilage, but then the diarthrosis are the synovial ones. Those are the ones that move around. Okay, so these don't move much. So these would be like the sutures in your skull, your teeth, right, in the bone. Amphiarthrosis would be things like the intervertebral discs, and then diarthrosis are things like your knees, your shoulders. So slightly movable, or they don't move a lot. Okay, so the pubic symphysis. Okay, now range of motion. So range of motion depends, right? So there can be no movement to extensive movement. Okay, the structure of the joint determines whether it can move or not. And there's an inverse relationship between how mobile a joint is and how stable it is. So, so the sutures in your skull don't move. Okay, they're not mobile at all, but they're really, really stable. So they're good at protecting you. Whereas, like your knee moves freely, but it's not very stable. So you have people might have lots of knee injuries. Okay, so this picture is supposed to try to show you that. And this is kind of hard to read, but here's immobile, okay, and here's most mobile. So this is a shoulder. So this is showing her shoulder, which is a synovial joint. And then here is a fibrous joint in her skull, and then cartilaginous joints in her back. So the idea is just to give you, give you a picture of what's going on. So synovial, which are movable, right? So like her knee, fibrous joints will be in her skull. They're not very movable. And then cartilaginous, which are, they're pointing to her vertebrae. Okay, so they're in between. Okay, so fibrous joints, what are their characteristics? So they're connected by dense, regular connective tissue. Okay, so it's really dense. There's no joint cavity. They don't move very much. And there's 3 types. So gomphosis, a suture, and syndesmosis. And those are lovely words, aren't they? Okay, now, gomphosis. What a gomphosis is they describe it as a peg in the socket. So that's what your teeth are. Okay, so it's the teeth and how they go into the mandible and the maxilla. Okay, so the teeth are anchored in there by periodontal membranes. Okay, so there's they're held in there by those membranes, and they function as a synarthrosis. Okay, now sutures are between some skull bones. Okay, so they don't have really short fibers connecting them together. They can have irregular edges that kind of are like a puzzle piece, that how they get linked together. So it makes them stronger because of the way that they're interlocking. Okay, so they function as synarthrosis. They allow our brain to grow in childhood, so our skull can expand. But as we age, they become ossified and become more bone-like. Okay, then syndesmosis. Okay, these are things like in your forearm. Okay, so it's between the radius and the ulna. And what they have is they have an interosseous. Okay, so inter is in between and osseous is bone. So there's a membrane between the bones. Okay, so it's found in your arm and in your lower leg. So it's found between the radius and the ulna and the tibia and the fibula. Okay, so it provides a pivot point. So if you think about turning your arm, okay, the bones are kind of moving together and you can pivot your arm. So they're an amphiarthrosis. Okay, now cartilaginous joints. Okay, so they have hyaline cartilage or fibrocartilage between the bones. They don't have a joint cavity. They could be mobile or slightly mobile or immobile, and they're synchondrosis or symphysis. Okay, so a synchondrosis, okay, so syn and then con, okay, these are bones that are joined by hyaline cartilage and they're not mobile normally. Okay, so here's an example is in the long bones, the epiphyseal plate is considered a synchondrosis. So it's cartilage there. Okay, between your ribs and your sternum, okay, you have hyaline cartilage, and that joint is a synchondrosis. Okay, so it's not moving around that much. Okay, now a symphysis. Okay, so 2 symphysis that we talk about are, one is the pubic symphysis, which is the cartilage in between the bones in the front of the pelvis. Okay, and then in between the vertebrae. Okay, so there's the intervertebral disc. Okay, so what they have is they have fibrocartilage between them, and the fibrocartilage resists compression. Okay, it's kind of like a shock absorber. There's a little bit of mobility in them. Okay, now synovial joints. So synovial joints have a cavity in them. Most of the joints in our body are synovial joints. Okay, so they're freely movable. They come with some basic features, right? So they all have an articular capsule and a joint cavity. They have synovial fluid. They have articular cartilage, and they have ligaments, nerves, and blood vessels. Okay, so that means you can feel things at them, right? And they have a blood supply. Okay, so here is a picture of a typical synovial joint. This is one that's used frequently. Okay, so here's the bone. Here's one bone. Okay, and here's another bone. Here's ligament holding the bones together. Okay, so there's ligament holding the bones together. At the ends of the bones, you're going to find, the ends of the bones, you're going to find articular cartilage. Okay, so it articulates, so it's covering the ends of the bones. There's the purple is the joint cavity. Okay, so it is a cavity. And inside of that cavity, you're going to have a synovial membrane, and there's fluid, synovial fluid. And we'll talk about that here in a minute. Okay, so the synovial fluid is in there, so it's not dry, right? It's liquidy. Okay, so there's a fibrous outer layer to the capsule, to the articular capsule. Then there's a synovial membrane, which is going to make the fluid. And then there's a cavity. Okay, so in between these bones, it's kind of like a sac. And that sac has an outer lining. It's like you double bagged it. Outer lining, an inner lining, and then there's fluid in there. Okay, so this is what this says. Okay, so there's an outer fibrous layer. Okay, it strengthens the joints and helps keep the bones from being pulled apart. Okay, so this blue layer kind of keeps things together. An inner synovial membrane. It's made of the areolar tissue. Okay, it helps cover the joint surfaces that might not be covered by this articular cartilage. Okay, and it's going to help make synovial fluid. Okay, so this joint capsule is called an articular capsule. Okay, now articular cartilage is hyaline cartilage. So articular cartilage covers the surface of the bone. I always kind of think of it as like Teflon. So, and I know Teflon is not, people don't like Teflon on their pans or anything anymore, but it covers the surface. Okay, so what it does is it's going to reduce friction. So when your bones rub together, it should be smooth. Okay, it can act as a cushion. Okay, so that there's pressure, and it helps protect the ends of your bones. Okay, so when somebody has arthritis, lots of times that articular cartilage is damaged. So if you look at an x-ray or an MRI that somebody shows you that they're like, oh, I'm going to have knee surgery, or I have lots of arthritis. So this cartilage is damaged, okay? And instead of having a nice, clear, distinct line on the x-ray, it's going to look all kind of cloudy. Okay, so the articular cartilage, because it is cartilage, it's avascular. Okay, so no blood supply to it. So that means that it's hard to heal. Okay, now in the joint cavity, so that's the space. Okay, it's lined with the synovial membrane, and it has the synovial fluid. So the fluid is kind of viscous and oily. So I think about your joints, and you want your joints to move freely together. You don't want things rubbing. You don't want a rough surface. So the synovial fluid lubricates the articular cartilage, and then it's going to also nourish and remove waste from the articular cartilage's cells. Okay, so remember, they don't have a blood supply, so they're not getting blood brought to them, but this synovial fluid will help take waste away and bring nutrients to the cartilage cells, the chondrocytes. Okay, it can also act as a shock absorber. Okay, so it kind of, if there's liquid somewhere, it's going to help things from bouncing around. Okay, now ligaments, we've talked about a little bit before. They're dense, regular connective tissue. They connect right? So bone to bone. And the idea is they're going to stabilize the joints so that they stay together. Okay, there's two different types of ligaments. There's extrinsic and there's intrinsic. Okay, so extrinsic are not part of the joint capsule, where the intrinsic are part of the capsule. Okay, so synovial joints have sensory nerves and they have blood vessels. Okay, so you can detect pain there. They also have receptors like proprioceptors, right? So, and baroreceptors. So you can detect where you are in space, whether things are stretching, movement. Okay, now tendons, dense regular connective tissue, they're not part of the synovial joint and they're going to attach muscle to bone. Okay, and the idea, they're going to stabilize the joints so they're not flopping around. Okay, now another thing, bursa. Okay, so bursae or bursa, right, a singular one, it's a sac and it's made out of fiber and it's got synovial fluid in it. Okay, so let me show you a picture. Okay, so here, this is the knee joint and there are bursa in there. Okay, so everything that's blue on here are bursa, and you've heard of bursitis, right? So bursitis is when these bursa actually become inflamed and they can fill with fluid. Okay, so there's one before the knee. Okay, so here's the kneecap, right? Here's the patella. Okay, so the pre-patella bursa, there's one right below that. And then inferior, there's the infrapatellar bursa. And then there's some on the back of the leg too. Okay, so they have a synovial membrane that lines them. Okay, they're found in joints where the bones, ligaments, muscles, and tendons rub together. So the knee is a good place, the shoulder, the fingers. Okay, so the whole point of them is to alleviate friction. So they're almost like little airbags, but they're filled with fluid. Okay, I had this one I had it be inflamed, so it would swell around my kneecap when it was inflamed. Okay, now arthritis. Okay, did I spell it right? Arthritis. I don't think I spelled it right, but arthritis. There, sorry. Okay, so this is arthritis. So arthritis is when the articular cartilage starts to wear and the bone starts rubbing against bone. Okay, now some joints have even more, I call them accessory structures, so extra things. Okay, so they have tendon sheaths, which are elongated bursa. So it's bursa that totally wrap around. So like if this is your hand, okay, a tendon sheath, that's what these blue things are. Okay, and they wrap around the tendons. Okay, and it's gonna help prevent friction. Okay, so you have them in your fingers and your wrists. Some places also have fat pads. Okay, so it's extra fat that's in there. And that's going to help. At any time you have fat in there, it's either acting as storage for energy or it could be like a shock absorber. It's protection. Okay, now, if we just talk about synovial joints, okay, synovial joints, we're going to classify by how they move. Okay, so uniaxial movement means it just moves in one plane or axis. Okay, bi means it moves in two, and multi means it can go all over the place. So it can go in many axes. Okay, so joints can also be classified, synovial joints can also be classified by the shape. Okay, so if we go from least mobile to most mobile, okay, and you can think about like plane joints, hinge, things that hinge, things that pivot, things that are condyle, saddle joints, and then ball and socket joints. Okay, so these move the most. So let's kind of look at that. Okay, so plane joints are when you have a flat articular surface. Okay, so they don't really provide a lot of movement. Okay, so they're very, things glide. Okay, they don't move a lot. I'm trying to think of an example. I wonder if I have an example in here. There's an example in the book. Okay, a hinge joint. Okay, so it moves in one direction. So that's more like a hinge of a door. And this is this is your elbow. Okay, a pivot joint. So when you have a ball that has a rounded surface, a bone with a rounded surface fits into a ligament. Okay, so they only go in one direction as well. And this is the way that your radius and your ulna work. And the dens and the atlas. So the top vertebrae in your head, in your neck. Okay, condyle, which is, I can't say that word very well. Okay, so you have an oval convex surface that articulates with a concave surface, and they can go in two directions. Okay, and you have these in your wrists. A saddle joint is you have in your thumb, in the base of your thumb. And then the ball and socket joint is the one that gives you the most movement, right? So the ball and socket is like your shoulder, your hip. Okay, so it can move all over the place. Okay, what I think you should know for this is you should know in general the least mobile to the most mobile. Okay, so you should know what's you can move a lot and what you can't move a lot. You should definitely know ball and socket joint, okay, and where you would find it. So maybe be able to do some matching with these so you can match how this plane joint with how it moves and an example of where it is. Okay, now in this chapter, they talk about motion and describing the types of motion. So there's some vocabulary in here. Okay, so angular motion is going to decrease or increase the angle between two bones. And there are a bunch of vocabulary words, and they I think they make sense. Okay, so flexion is movement in the anterior and posterior plane, and it's going to bring the bones closer together. So if you bend your finger and you make a fist, that's flexion. Okay, extension is the opposite of flexion. So extension is when you increase the angle. So you open up your hand after making a fist. Okay, hyperextension is extending the joint more than 180 degrees. Okay, so it's hyperextended. So think about sitting and looking up at the ceiling and tilting your head back. That is hyperextension. Okay, lateral flexion is when you go lateral, you move your trunk laterally. Okay, and it's between the vertebrae. So there's some pictures here. Okay, so if we look here, so flexion is going forward, hyperextension is going backwards. Same thing here. So flexion, you're decreasing the angle. Extension, you're increasing the angle. Same thing here, same thing here. Okay, and then lateral flexion is tilting the torso to the side. Okay, now abduction is moving things away. So if someone's abducted, if you're abducted, right, they take you away from your family. Okay, so abduction is moving things away from the midline, and adduction is moving things towards the midline. Okay, so here's a picture. She's abducting. So she's moving her arm up. Okay, here is, and then when she moves her arm back down, she's adduction. Okay, and there's examples of this all over. So there's 4 different examples of ab and ad. Okay, circumduction is spinning something in a circle. Okay. Rotational movement. So rotation, so we're pivoting. So lateral, medial, and then pronation and supination. Okay, so lateral rotation is we're turning the thing away from the body, okay, like here. And medial rotation is we're bringing it back into the body. Same thing with your legs. If you point your toe out, that's lateral. Medial is you're bringing it back in. Okay, now pronation and supination. Okay, so you hear this when people are talking about their feet. Okay, but you can use it for hands. Okay, so pronation is when you rotate the forearm medially. Okay, so pronation is you're taking your hand and you're going, turning it over so you're not in anatomical position. In supination, it's going the other way. So I always think if you can carry a bowl of soup, you're supinating, okay, because your palms are up. Special movements. Okay, so depression is when you move something, like you're moving your mouth. Elevation is when you're raising something. Okay, so here's shrugging your shoulders. Okay, so depression is when you're pushing them down and you're trying to relax and take a deep breath. And elevation is when you're all tensed up and your shoulders are up. Okay, now your foot. Okay, so dorsiflexion is when you pull your toes up and your heel is down. Whereas plantar flexion is when you're standing on your toes, your tiptoes. Okay, now eversion and inversion. So this is only in your foot. Okay, so it only occurs in the intertarsal joints of your foot. You don't usually have an eversion any other place in your body. Okay, so if you lift your soles laterally, okay, that's eversion. But if you raise your feet up towards, raise your sole up medially, that's an inversion. So E is going to the outside and in is coming to the inside. Okay, protraction and retraction. So protraction, you're pushing your chin out, and retraction, you're pulling your chin in. Okay, opposition is when you move your thumb to your little finger, okay, or to the tips of your finger. So they say we have opposable thumbs. Okay, so opposable thumbs mean we can do this. We can grasp small objects with our thumbs, which if you didn't have this, you'd have challenges, be harder to write, harder to like use a mouse, harder to use your phone, all that kind of stuff. Okay, and that is it. So the main things, right, are to understand, I'm trying to get back to the beginning, which I guess it doesn't matter. Understand the types of joints and how they're classified functionally and structurally. Okay, so like what they look like and what they do. I don't expect you to go over and through and learn all the muscles, tendons, and ligaments in those joints that they talk about in the book.